Becca, you know, when we think about where do we get our energy, not from the brain, not from the stomach, not from our red blood cells, not from the pancreas. There's a gland in the neck called a thyroid gland. It's built like a little butterfly. It puts out two hormones, T3 and T4, and those hormones are responsible for the energy we got. They cause metabolism in our cells. So if the thyroid gland is overactive, then we may get too much metabolism. Our skin gets fine and moist. We may get a fine tremor. We may get nervous and upset. We may eat a lot of food but still lose weight. Our pulse gets fast and rapid. Sometimes we have difficulty sleeping because our thyroid gland is just too overactive. The testing for thyroid activity is very, very simple. There's a blood work called a TSH, and that will help the doctor know if your thyroid gland is too overactive, or if it's too underactive, or if it's perfect. Now, if there is too much thyroid hormone, then there are some medicines to block the hormone that we can use. We can also use radioactive iodine uptake, which goes to the thyroid gland and helps shrink the cells and actually kill some of the cells that are there so it won't cause so much trouble. So if you find that you're irritable, nervous, upset, anxious, not sleeping well, have moist, warm skin, think of your thyroid. Your thyroid is responsible for that energy that we've all got, but if we've got too much, it can cause problems also. And now, a question from the viewer says, Dr. Bob, I don't have any energy. What could be the problem? Well, there's lots of problems that people have that cause them not to feel energetic. Sometimes it's just too much stress. Sometimes it's a little depression. Sometimes we're just not sleeping well. Sometimes it's pain that keeps us awake. But it can be an underactive thyroid. And if we get an underactive thyroid, that same gland that we were talking about, our skin may get dry, our voice gets hoarse, we feel sluggish, we have cold intolerance. We just can't stand the cold. We get tired and fatigued. Now, it's also easy to diagnose with a blood test called a TSH. And the nice thing about an underactive thyroid, the treatment with thyroid hormone tablets is very inexpensive and very, very effective. So, too tired, sluggish, skin dry, think of your thyroid. Nervous, irritable, think of your thyroid. You know, testing can be treated, and the treatment is excellent. So be sure that you talk with your doctor if you're not having the energy that you think you should have. And now, Rebecca and Sean, it's back to you for an energetic pre-Christmas time to all the Channel 10 viewers.